I think it's just overall is that communication is just so incredibly key. It's going to sound a bit cliche coming from a psychologist saying that you should talk about things, um, but it really is just so important. When you have a cancer diagnosis, people talk about the past me and the new me. As I was saying, you're navigating the new you,
Yeah,
and it's going to take time, and your emotions are going to fluctuate. And I think, you mentioned before about like the scarring that can happen from interventions. Even if you've maybe sort of processed and gone past this experience of cancer, it can still be a reminder. And so it's being able to talk about that even years down the line. It can still catch you, and that's okay. It's normal. But if you're talking to people and you're able to be open and honest and vulnerable, then that's what's really going to help you get through it ultimately.
yeah. Like you say, I think it's that acceptance and saying it's okay to feel these emotions. It's really, you're not being weak. You're not being, it's you've got to have this to process what you've gone through and what you're going through. There's lots and lots of there's also lots and lots of information out there that you can
Mm.
grab hold of, um, to help you. And really, if you are my advice, if you're really feeling these things, then get help. Ask, talk. You know, do whatever you need to do to help yourself. One of the things, be kind to yourself. I used to wince a little bit towards that because I didn't know quite what it meant, I suppose. But be kind to yourself. Go out for a walk in the countryside and enjoy the outside. In nature is a massive thing for me. If I can get outside and be outside, then that helps me knowing, even if it's when I after the operation, just to get up for 5 minutes, go outside, sit down in the sunshine or whatever,
Yeah.
and come back in again. Just do that a couple of times a day. It helps so much. It really
Yeah.
did. Yeah.
Yeah. Yeah, being out in nature is incredibly powerful, actually. It lowers heart rate, it lowers blood pressure. So yeah, if you can get outside, even if it is for 5 minutes, it's definitely, yeah, very, very good for you.
Yeah. I mean, what I was doing is just building it up throughout the week. It might be
Mhm.
5 minutes a day for a week, and then, in your healing process, it's an important time, I think.
Right. Yeah, I think yeah, so that I think that's it. We're done. Thank you, Jamie.